皆様お待たせいたしました。それではただいまよりシンポジウム海外事例12を開始いたします。座長のシンディ・チャウ様、どうぞよろしくお願いいたします。Thank you very much for your patience. Now we start Symposium Overseas Practice Session 12. The chair is Ms. Cindy Chow. Ms. Chow, would you like to start? Please give them a round of applause. それでは盛大な拍手をお願いいたします。
Hi, good morning, everyone. Thanks for coming to this session. Today, maybe I should introduce myself. I'm Cindy Chow. I'm one of the committee members of the Occupational Safety and Health Council from Hong Kong. So good morning, everyone. And today we have the pleasure of having a number 6 very distinguished speakers to share with us how they use technology and innovation to improve safety, health, and well-being for everyone, not only at work, but I think also on our daily lives. So we have a lot of content, so I won't go into details of everyone's profile, but I'll just introduce them one by one. Professor Benny C, Chief Executive Officer of HealthView Bioanalytics Limited. Professor C applied AI and cloud computing and machine learning for non-intrusive health checks through AREA, which is a research invention by a professor. And next, the next speaker is Mr. Simon Wong, the Chief Executive Officer of Logistics and Supply Chain Multi-Tech R&D Center Limited. So Mr. Wong will present the Power Assist Trolley and Follow Me robots for improving logistics efficiencies, especially for protecting our bag. And then the third speaker is Mr. Richard Hall, Managing Director of Citybus Limited. Mr. Hall is really supportive. He just arrived this morning in Osaka and rushed to here to share with us a people-centered approach to create happier and healthier workplaces. I am a long-term, passenger of Citybus, and I really appreciate the service by their staff. Follow Richard is Professor Kelvin Ho. Professor Ho will share with us the lower back exosuits, a lightweight and affordable one, so to help workers. And the next speaker is Mr. Harris Sun, Chief Executive Officer of Respect. Respect is using AI-driven predictive maintenance drones to really enhance the workplace safety and employee well-being in smart buildings. Especially, we don't need people to climb up buildings to do inspection, but rather to use the drone and the AI algorithm to do the inspection. And last but not least is Mr. Ray Choi, Senior Consultant of Occupational Safety and Health Council. Mr. Choi will present to us the evolving science-based processes to find the optimal heat stress prevention solution. I think this is very relevant to every one of us here because this is a burning day in Osaka. So Mr. Choi will share with us the experience that we are doing in Hong Kong to help protect the safety of our workers. So without further ado, I would like to pass the stage to Professor C. Benny, please.
Thank you. Thank you very much. It's my honor to be here and to show our technology apply in occupational health and safety. Actually, I originally planned to have a real-life demo in Osaka, but due to the problem of import and a lot of other difficulties, we eventually postpone that arrangement. Hopefully next year I can actually do some real-life demos so that people can get a real-life experience of the technology, which is a very fast, accurate, and fully automated using artificial intelligence to do something that is relevant to everyone, including people who are working in the constructions place or working in as a teacher, because of the health-related issue is closely linked to the occupation of this individual. Now, the idea is very simple. We use a retinal image, which is at the back of the eye, and that retinal image connected to the brain and all the vessels in the body. So we are able to use AI technology to take out all the risk associated with this healthy problem. So today I'm going to show, this is a technology we have been using in Hong Kong, and now we are already commercialized in China, and also I'm going to Australia and also work on the area in Australia. The process is very simple. We capture retinal image with about 2 minutes, upload to the cloud server. Of course, in each of the country, the cloud server will stay in the country. It will not leave the country. And then analysis can be done in just a few minutes, and then we will send back the report. The report can be sent back to the individual because the individual is the person who need to know their own risk. So we are talking about risk, not disease. Because at the time the person have risk, they can do something to change their risk so that everybody become a healthier, safer environment in the workplace and at home. So we will also work with Cardiff University and Swansea in UK. So the technology works in Asian population as well as Caucasian population because it's an imaging thing. It's not DNA, it's not genetic things. So since then, we publish, since we filed our patent in 2014 and 2017 in China and Taiwan and so on, we've started publishing. And we obtained a few number of awards. I moved the company to Shanghai because Shanghai is very active in business. So we have registered another company in Shanghai. We received some awards in Middle East and Geneva, and some recognition from the Hong Kong government and so on. Insurance company is one of our important sectors. So we won some Prudential Health Tech Award and also China Innovation Award. So get back to the content of it. We separate our technology into 3 different developments. The first thing is physical health. So physical health is the most easily understand in terms of health concept. Later on, I'm going to talk about cognitive health and mental health. But physical health is the first things that we talk about. You see, diabetes is one of the things that is very important to our society. Before we have diabetes, we have something called pre-diabetes. It's very difficult to assess and take them out. But according to our colleagues' research in the Chinese University of Hong Kong, 90% of people with pre-diabetes in their lifetime will eventually become a diabetes person. So that means if you don't take any precaution, if you don't take any action, almost all that pre-diabetes people eventually will become diabetic. So with diabetic patients, then the problem is that they may develop a various problem in terms of complication. They may have stroke, coronary heart disease, or chronic kidney disease. So all of these are fatal disease. But at the time that they have diabetes, they feel nothing. Okay, so that's the problem. So when in the workplace, you may see 10% or 20% of people already have diabetes, but sometimes they don't go to check their body frequent enough, or disbelieve that their blood sugar is already elevated, and just ignore them. So eventually, by the time they realize they have diabetes, the harm and the problem generated with the complication is already very serious. So our company wants to tell people very, very early, with the risk in their blood vessels and all this information, tell them that they should avoid becoming diabetic complication. So we have done a study, although the title of this paper is Undiagnosed Diabetes, because we want people to know that if they have diabetes, for how long. So we are not looking at blood sugar. We are looking at the impact of blood sugar to the organs and the vessels. So the result shows more than 90% accuracy, both sensitivity and specificity. And we also use some other data to validate it, both UK data and Hong Kong data to validate the model. The sensitivity is still very, very high. And when we look at some of the pre-diabetes and undiagnosed diabetes in the community, that means they are very early or the risk using our model shows a moderate risk. That means if you have a moderate risk, you still have time to reverse it. So that's the most important thing. The company don't have to fire everybody, right? You keep your employee and make them healthy so that your company can grow and make more money. Okay, and diabetic actually has a lot of other things. So I do a study in the community, very simple study. I get 200 people in the community and separate them using my model, diabetic versus no diabetic. So you can see the blue lines, the blue bars are non-diabetic, and the gray bar are diabetic. So using the technology that we use, diabetes patients in the community, they don't know even they have diabetes, or this is just high risk. At the same time, for those with high risk of diabetes, they have high risk of coronary heart disease, high risk of ischemic stroke, these are all significant, high risk of chronic kidney disease, and high risk of dementia. You can see the damage of diabetes. But one thing is very funny, for mental health, doesn't matter whether you have diabetes. In Hong Kong, everybody have mental problem. So both diabetic and non-diabetic, they all very stressed. Okay? Anyway, so with diabetes people, at least one problem, at least one complication is around 70%. So 70% of diabetic people have at least one fatal risk that you need to deal with. So this is a very important thing. The second important thing is cognitive function. Okay, if you have a relative with dementia, you know how terrible it is. It's a terrible disease. So we published a paper some time ago to identify these are the people without any symptom. They haven't had a stroke before. No symptom, no dementia at all. And when we took their MRI, we can see some people have moderate to severe white matter hyperintensity. So dementia has two very important risk factors. One is genetics, EPO4, and other is imaging, the white matter hyperintensity in MRI. So if we know that someone without symptom have moderate to severe risk, high risk of white matter hyperintensity, you know this individual in a few years, they will start developing symptoms. Their memory will be affected, their motor function, speech may be affected, and so on. So we don't want to see people have high risk and they do not know. So we do a study using retinal image together with MRI and compare. Look at the result. This is the y-axis of this is digitization of the MRI itself. Calculate the total volume of white matter hyperintensity. And the x-axis is the calculation by the retinal image automatically. So on the y-axis, you need to spend 2 hours to digitize one picture. In the x-axis, you need 2 minutes automatically do the analysis. So in terms of the cost, and on the y-axis, you need to do an MRI. That means you need a team of people with a very expensive machine to do the MRI, and you need to spend a whole morning. On the y-axis, you need to spend 2 minutes to take the retinal fundus photo, and then you can do it anywhere. So that's the difference, and the correlation is 0.89. So highly correlated, and then if I separate them into low risk and high risk based on the MRI, using the retinal image, the sensitivity and specificity is 93.98%. So in other words, we may not need to go to your hospital to do MRI if we want to use it as a risk assessment tool. You can do it almost every week, every month, and you can monitoring your risk factors, the major risk factors in dementia. So I do further research and find out that using the retinal image, I can actually see which part of the brain have high white matter hyperintensity. So this is new to a lot of pathologists, because a lot of times we do not know how to study the anatomy of these vessels in the retina. So, but we sort that out. And then another paper, we have demonstrated that white matter hyperintensity can be changed. Of course, some people change from moderate risk to high risk within 1 year. In this study, we didn't use any intervention. We just follow them up. And then we find out that those with baseline high risk of white matter, okay, their overall cognitive function will decline. However, for those with a good health responsibility, that means they take care of themselves, they have a significant reduction in terms of the white matter hyperintensity. So that means if you do something about your health, you are able to reduce your risk factors dramatically, significantly. So that's the message. A lot of people don't take care of themselves because they thought they have nothing. But even they know they have diabetes or some problem, they gave up because they thought they cannot do anything about it. Because there's no drug that can, the doctor may tell you that there's no drug to help you. But you don't need drug at this stage because you don't have disease. You need to take care of your health at this stage so that your risk can be reduced. And I can tell you how much risk you have and whether you need to do something actively to reduce your risk. So from a company point of view, if all your employees take care of their health, you will gain significantly. At least you will save a lot of money on the healthcare costs, right? On the insurance. And the last thing is mental health. We have actually worked on the mental health a lot in the last 2 years because mental health is very difficult to assess. And especially when we assessing depression, you need to have a professional asking professional questions, spend hours, and eventually sort out whether the person have depression. But using this technology, using the same retinal photo, we can understand whether the person have depression. So this study is done in Castle Peak Hospital, a psychiatric hospital in Hong Kong. And we use the most severe depression case to develop the model. And we have a highly significant model sensitivity and specificity, both over 98%. And I have done some community study. This is one of them. Using CHQ-9 as questionnaire that a social worker and a lot of healthcare professionals will use to assess whether an individual have depression. And what they found out is using this model, they are at a moderate range risk. So that means if we use this retinal image model in the community, we will be able to pick up moderate risk individuals. That means I'm not saying that your employee has depression. It's just they have high risk of depression in the community, and that can be reversed if you provide them very simple counseling, some social workshop activities, and things like that. So a better life will change that depression risk dramatically. So our idea is that if we use this simple technology in the company, in the community, once we detect certain degree of risk, they can do something on their own. So for example, quit smoking, quit drinking a lot of alcohol. All of these activities save money, not spending more money, and make yourself happier and healthier. Then you will reduce the risk. And then you come back and do a little bit follow-up, and you're trying to keep your risk at the low level. That will keep everybody healthy, both in the company as well as in the community. Thank you. We hope to have more collaboration in the future internationally with a lot of people so that we can become a better community worldwide, as well as saving a lot of money in the healthcare costs. Thank you.
Thanks so much. Very good time management. So next speaker, may I invite Mr. Simon Wong to the stage to share his how he has been using technology to promote health and safety at workplace.
Good morning, David. Good morning, Bonnie, ladies and gentlemen. The first point I want to make is I want to take a test, Professor. After we go back to Hong Kong, I really need a checkup. Okay, today I'm going to talk a little bit about part of the work we do on trying to help the workers in Hong Kong. And just a very simple introduction of my center. We are LSCM R&D Center. We are under the Innovation and Technology Commission of the SAR government. Basically, I won't go to the details, but we are in applied research field, and we work very closely with the government, with the industry, and with the academia. We cover a lot of fields, from logistic and supply chain to smart city, trade facilitation, and of course, infrastructure and community work. And that is why we are very closely associated with OSHC, because we have been collaborating for years trying to improve the safety of workers. And also we are very closely related to construction industry, which is part of our focus in improving worker health and safety. Just some background, okay? Hong Kong is also one of the rapidly aging society. It is estimated people over 65 years old will be almost 2.5 million by 2038. Right now it's 2025. I estimate it is around 1.9 to 2 million right now. So you see, we are migrating into an aging society, and we're talking about almost over 30% people over 65 years old by 2038. And what does that mean? Health-wise, and I'm so glad to hear from Professor, if you have 2.5 million people over 65 by 2038, that means you have more than 3 million people in Hong Kong who will have chronic disease, who needs chronic health care. OH is one thing, but also normally we have people who are sick due to heredity and some other reasons. So you are talking about a tremendous burden on the city. In the next 10 years, we need more method to ensure the health of our population, and today the good news is that we have a very effective testing. And that also reflects to labor force. Right now you see a gradual increase of workers over 65 years old, from 4% in 2019, 5 years ago, to now is over 6%. That means for every 100 working employee, you have 6% over 65 years old. I'm one of them, okay? I need to disclose. Although I look like I'm 80, but actually I'm only barely over 65. That poses a huge challenge to Hong Kong, both in health and occupational safety, because OH reflects into actually a lot more challenges while you work. Okay, let's look at the not so happy part. Okay, actually with the effort of the government and of the industry, the accident rate, generally speaking, is on a downward trend, which is a good sign. Okay, and in 2023, every 1,000 workers, the accident rate is 13.8. However, having said that, among that 13.8, if you focus on construction industry, unfortunately, is higher. We are talking about in construction industry, it's not 13.8, it's more than 20 per 1,000. So you are talking about generally a downward trend on worker safety, but we still have a major challenge in strenuous work in construction, and I will further extend that to logistics. Because right now, a lot of workers are actually working on logistics environment, including warehouse, the port, airport, and particularly e-commerce. A lot of people are engaged in delivery. So all these are challenges, particularly when you have an aging workforce. Three main areas we can do. Of course, training for high-risk factor, trying to avoid fatality, try to avoid accidents in the workplace. That can be done by training. Strengthening enforcement of the safety regulations, thanks to OSHC, because in recent years, the requirement and also the penalty of not observing safety, particularly in construction work, is very commendable. But it's a never-ending journey. We still need to work hard. And the third one, of course, is part of what we do, introduce technology to SMEs, who are the weakest in the link in using new technology or using new innovations. Talking about innovations, for the more than 10 years of experience in trying to do work safety improvement, there are many barriers. The first one, of course, is high cost. Every time when a small enterprise think about adopting technology, they will think about extra costs. They will never think about how much cost I can save, because you are talking about opportunity cost. Maybe only it lower down your accident rate, but you don't see accident right now. So getting the cost down and also make it easier to entry is the first challenge of adopting technology. The government is doing a lot of that. Many bureaus and departments are offering schemes to encourage adoption of technology. That's one point of using it. But I think another thing is the big enterprise will need to take the lead, which they have, I'm happy to say, in introducing technology. Space limitation, we are talking about it in Japan. I think our Japanese friends will agree. Hong Kong, we operate in a very dense environment. It is very peculiar to cities like Hong Kong. Vertical infrastructure, same thing. We need to work on slopes. We need to work on construction site, which is basically very vertical, and we don't have a lot of room to maneuver. And that all leads to limited adaptability. A lot of times, the solution we make is not general. A lot of times, it's each case we need to have a specific solution, and then makes it very difficult to promulgate a specific technology that can help everybody in the industry. And then the last but not least, we have many solutions, but it needs integration. Integration barrier is also another big challenging. It's both from the technology side and also from the industry side. Because if you have an industry broken down into a few big players, it's very hard for them to be willing to work together for a common action. Sometimes they all have their own solutions, which make the integration very difficult. Well, despite of all that, we do have progress throughout the years. And this year, we brought these two examples to Japan. One is power-assisted trolley, and other one is follow-me robot, which you can see in demonstration in our booth. It's very simple idea. It's to lessen the hard work of the workers and stay away from the high cost of a full-fledged robot. So we are having these two targets in our mind to design this. And although it looks simple, it takes us more than 2 years to perfect the product. And how it works is very simple. It's versatile. It can be operated any place, indoor and outdoor. And as you see, by putting intelligence in a control, it actually tells the user's intention very well. So that you can push forward, you can move very adroitly, and it's very simple to use, so very simple to store, and that makes people tend to accept it with ease. And on the right-hand corner, the below corner, we got a gold medal in the Geneva Innovation Award, and you can see young girl and also other people handling it with great ease. We hope that we can promote it, in particular, to the logistic and construction industry in Hong Kong. Another one is the follow-me robot. This is actually a delivery bot. We designed it to make sure it can be used in a dynamic environment, particularly in a very narrow working area. It helps to alleviate the manual transport, and also it frees up hand for the employee or workers. They can operate on their smart pad or smartphone while the delivery bot will follow them. It's very easy to use again. It is like a backpack style. You can put in this particular case, it's a lunch box for a hospital and for elderly home. And this one is another collection bag. You can just hook it up, and then it will follow the employee inside a building, a warehouse, and many other working environments. So these tools are what we call the foundation layer of the innovations we are bringing it to the industry. And what more can we do? A lot more. I'm using the remaining 3 minutes just to go through. This one is for hygienic hospital environment and a very high requirement and standard in operation environment. This particular one is to use to transport very heavy casing in a very secure way. So it can get into elevator and move from one floor to another floor. With modification, this can also be used in outdoor and in particular in construction site. This one is another interesting innovation. This is a remote control stacker. Actually, the original model was and has been and still is being used by Town Gas, which Town Gas introduced it yesterday. But right now we extend it so that the worker can work in an office environment and remote control the stacker in a warehouse, multiple stacker, one person. And the telecommunication method is 5G. So this will also reduce the risk of operation of heavy load inside the warehouse and in many other operation environment. Back to what we talk about construction safety. For years, we have been working on reminding the workers when they work at height to buckle up properly. So this safety belt alarm system, not only that it makes sure that you lock up, you buckle up, but also it tests whether you lock up correctly. Because the safety rope that you clinch onto, it actually is directional. You have to lock it up at the right direction in order for the safety system, for the safety belt to work properly. We are promoting it. We hope they will be more widely adopted because every life is worth saving. There's no reason that we risk the worker's life in doing this kind of work. We also, thanks to OSHC, we actually installed this training VR cave in their premise to help remind the workers how important it is to buckle up the safety belt. Basically, we just let them die in the testing cave. So they know that it's not fun to fall from height. It's very successful so far. I think people got really impressed that they really need to take care of their own safety. Other projects that are in progress is that, again, we are working with university and also with the industry to use different kind of device to check their temperature. It is very difficult to prevent stroke because it's not just the body temperature. It is a lot of combination of our body functioning in order to lead to stroke. So what we are doing now is that in this particular project, we take particulars of a worker's health condition, and then we measure other readings like temperature, like his body temperature, humidity, so on and so forth. We hope to get a systematic way of preventing overwork under very stressful heat environment. And now I know that we can also check retina. I will consult Professor Xi on this. The last is becoming very common now. We have been doing it for over 10 years, is to use video AI to monitoring all the activity in a construction site. In particular, hopefully we can prevent unsafe work habits and unsafe work condition. Like any other technology, there's no 100% guarantee, but each tiny step is a great step to improve safety. And on that, I conclude with what we believe. With the technology of AI, AIoT, that is Internet of Things, video analytics, robots, etc., this is the solution to further improve occupation safety and health. And that sums up my presentation today. Thank you very much.
Thank you, Mr. Wang. Thanks. So just now, Professor Xi presentation shows that in Hong Kong, we are all very stressed, right? So it is very hard to get it's very important to create a happy working place. So may I invite the next speaker, Mr. Richard Hall, to share with us how he used a people-based approach to create a happy working place at Citybus.
Good morning, everyone. Very happy to be here today in Osaka, and I think hearing the two previous speakers this morning, the great thing about this panel today is we've got academia, we've got R&D, and we've got industry, all sitting together. And when we're talking about safety, we have to combine all those factors, and we have to be very aware of those different disciplines. And bring them all together. And when we bring them together, like we're doing today, hopefully, for you here in Osaka, we get amazing solutions around safety. So my name is Richard Hall. I'm the Managing Director of Citybus. Citybus is a public transport operator working for the Hong Kong government, delivering bus services across Hong Kong. Hong Kong has a very unique public transport system. It's the foundation of society and development within Hong Kong, and over 90% of daily journeys in Hong Kong are undertaken on public transport. So I think it's probably the leading city globally for public transport usage. So safety is incredibly important, and ultimately, we're talking about the customers that ride on our buses every single day. But to achieve that, we need to make sure that our workplace is safe, we have the correct culture, and that every single one of our employees is safe. Every single day on our buses, we carry more than 1.2 million customers, and when we look across the whole of Hong Kong on public transport every single day, there's more than 15 million people daily using public transport. So incredible numbers. So I think what we're all learning is, like I spoke about, combining academia and, get my slides in order. So, is around that we're actually not just industry-centric. Every industry has sharing and learning that we can do together, and we can use that to improve our own organizations. So in Citybus, as you can see on the slide behind me, we have more than 5,000 people, actually around 5,600 people working for us, and we've got a 45-year legacy in Hong Kong. And we're very proud of that legacy. And we want to make sure that we're around for the next 45 years to leave an even stronger legacy. And we're not just thinking about our staff, we're thinking about their families, their connected members, because how we treat them and how we behave really does affect their lives. It can affect their wives, their girlfriends, their boyfriends, their children, their elderly. So it's a really, really core responsibility that we have to look after our employees. And people often talk about slogans, and we were talking about this before we started this session today. And I believe very, very strongly that we shouldn't just be about slogans. We have to live and breathe health and safety. We have to live and breathe well-being. And many organizations say they have a policy, they have a slogan, they have an objective and a target, but how do you bring that to life? And hopefully during today's slot, I will bring it to life for you. And you can see here behind me, we're talking about core, so 4 key points. And this factors through from every single level, from myself, from our shareholders, to the frontline operatives that are delivering services across Hong Kong every day. It's about commitment, personal and to the organization, and the values and the safe working practices. It's about owning all those things, taking personal responsibility, not saying it's not my problem, it's somebody else's job. It's about taking responsibility for actions. It's about not walking by and seeing a problem and ignoring it, because if you do that, you become part of the problem. And it's about engaging. And engagement is not just a top-down thing. Actually, it really is a bottom-up thing. And, you know, successful organizations have an engagement strategy that allows open thinking, open speech, open dialogue, and respectful criticism to improve the future. And that's what we've really established in Citybus, that if there's a problem, if there's an issue, we talk about it and we find solutions. And often many of those solutions will come from our frontline workers that are experiencing those things every single day. So people are key. It was interesting hearing you know, one of my colleagues this morning talk about profitability and making money, yeah? And I actually really believe that if you get your people strategies right, you will make money. You can't make money if you don't have the right people strategy. It's a very interesting analogy. And this is all about how, you know, we impact our people, you know, the culture we create. And we talk in Hong Kong a lot, actually, about the feeling, the heart of the body. It's a very Hong Kong terminology, but it's a feeling that we all have. You know, from this deep depth of our bodies, it connects with our minds, and it demonstrates in our actions. So how do we deliver quality service? Well, actually, the people that are out there every single day seeing our customers, we have to serve them as leaders, as managers, as supervisors. They're our customers. And for too long in organizations, we don't look at our frontline employees as our customers. So that's a very, very key thing for us. And these guys and ladies are out there every single day, treating our customers, giving them safe journeys, and increasing our revenues and growing our business. I mentioned bottom-up culture. We set the vision. We set maybe the strategy to achieve that vision, the key actions or the key activities, but how do we make it happen on the ground? So as I said, we encourage people to speak up, engage, bring new ideas to the table. We actually create that open environment that every single level, somebody has a role and they feel valued about what they think. The worst thing is organizations, they say, oh, okay, let's set up a health and safety comments box. Drop your comments in here. Tell us what's going on. Let's have a well-being forum. And we engage with our employees, but we never do anything about it. We don't feed back to them. And feedback is critical, even if the answer is sometimes no, or we can't do it this way, but we can do it this way. So this is very, very, very important. And if we get all that right, we have a huge business impact. And when you're a business like transportation, you know, what that does is really move the business forward. So, the culture and talent is key. We're in a new world today. Young people think differently. They're more open, more expressive, and we have to engage with that. They want to work differently. They want different income patterns, little working hours, and you know, they want more holiday and more downtime. And transport's 365 days a year. 24 hours a day. So, you know, we have to get different talents into our workplace, and we've been very successful around doing that. And D&I, or diversity and inclusion as we know it, is something we live and breathe every single day. Doesn't matter where you come from, what your gender is, if you're good, you're in our business. And digitalization and technology is key. I heard my colleagues earlier talking about this, and but actually, digitalization doesn't replace people. It's complementary, and digitalization should be used to enhance people feeling, people skills, and people deliverability. So we're using this now, key as a tool to communicate, but also to support actions and activities. Food is important, you know. Actually, if people are well looked after and well satisfied, so we've created a new canteen and breakout zone, very new in a sort of transport environment. And this is a safe space where people can connect, they can relax, they can sleep and do many, many things, but they can grow and thrive together. So this is been launched around 7 months now, and has been really, really successful in pushing forward the engagement across the organization. And how people look is about how they feel. Designing a uniform that is comfortable. We look at health and safety and PPE and workwear. Often our employees are not comfortable in what they're wearing. If they're not comfortable in what they're wearing, they're not comfortable in how they're feeling, or they may not even wear it. So if we engage when we design and when we purchase, we can really, really do this. And it demonstrates your company's brand when your employees are very proud of wearing what you have designed for them. And honoring the success, the joy, the dedication is key. You know, staff activities, as you can see here behind, you know, bringing our bus captains to the fore, blue-collar workers, but saying, no, you're important. You know, getting them out there, making society understand that this is a very, very, very key thing. So I'm talking too much and I'm getting pushed for time. So I'm going to keep moving forward. And engagement between our employees and the community is also very important. Working with NGOs and charities, by doing good with others, we can create good in ourselves. And this is about well-being and minds and seeing different sectors of society, taking our employees out to do outreach work and connecting and really making them feel like contributors. This is a sort of key strategy as we move forward. And you can see here some examples of the volunteering that we're doing out in the community across Hong Kong. Well, to conclude, you know, we've been in Hong Kong for 45 years. Thriving starts from within. We're building a workplace where people come first. We don't just talk about it, we act and we feel what we do every single day. So our journey for 45 years will be another 45 years. And it's the blueprint, we believe, for global change. Thank you for hearing me today.
Thank you, Mr. Hall, and I wish City Bus has more than another 45 years, but even longer. So may I invite the next speaker, Professor Kelvin Ho, who will share with us the lower back exosuit, a lightweight and affordable as clothing. And I guess perhaps later on, Professor can also collaborate with Mr. Wong in terms of solving problems in the logistics sector. Professor, please.
Good morning, everyone. I'm Kelvin. So we are from a research team from the Hong Kong Polytechnic University in Building and Real Estate. So among the exhibition hall, so we are from a fairly young research team. So try to bear with us, and then we will try to present our exosuit project to all of you and see how we can collaborate together. So I believe I will start with asking everyone a problem. So have you experienced the lower back pain in your life? So this is a problem we commonly seen in the industry of construction, in logistics, in healthcare and rehabilitation. So everyone, we have heard of it before. But we know that this is a high prevalent disease among the world. And then we cost a lot of great financial costs because we need a lot of medical costs to deal with the patients. They have a lower back pain. We need to rehab them. And then it is better if we can prevent it from happening rather than we are trying to spend excessive financial costs in deal with the events. So what is the exact reason causing low back pain? Actually, there is no direct evidence showing what is the exact reason that people experience low back pain. But in the physiotherapist's point of view, so we try to encourage people to perform a proper living posture, just like we ask people to live with their legs using a squat posture to lift a heavy object. But most of the time, we do not really want to do that. We tend to use our lower back to lift a heavy object. So we call it a stooping posture. So this is somehow a problem. We observe that this may be the most prevalent issues, the prevalent reasons that people trying to get lower back injury after a prolonged work in their daily job. So this is the current response. So we think that there is some action we can do that. We try to promote loss of motion sensor, try to detect a worker on the field, whether they are in a correct or incorrect working posture. But this is just monitoring. We want to do more. We want to directly have some devices that teach or that assist the workers to do a correct posture in their work. And then therefore exoskeleton become an option in the industry. So you may have heard of some of the devices. So we definitely are not the first group in the world doing exoskeleton. So you may have looked at a lot of devices in the market. So I've listed some of them on the slides, but we see that their current problem is that it seems that they are very bulky. We are talking about 10 kilogram, 11 kilogram, or even heavier. So this is the problem that exoskeleton, we want to make it help people, but somehow the devices itself is trying to create extra burden to a worker. So this is, it is a good engineering product, but we want to make it as user-friendly as possible so it can be applied in the field. So this is a simple question. So are you willing to wear something very heavy that may impede your daily work? So that is why we try to come up with our new devices. So we call it as a smart exosuit. So we actually have some prototype outside our booth. So maybe if anyone are interested, you are welcome to visit our booth and have a try. So this is pneumatic actuation. So we use compressed air as the pneumatic source to control the exosuit. So this is a simple demonstration. So you can actually observe that it is like made up from multiple belts and straps, and then we strap on the lower back of a worker. So, and then we have some sensors embedded inside our shoes and to detect whether the person is in standing posture or whether they are bending their back. So we collect some of the data and then we classify based on the data set to determine between standing posture and living posture. And below, we have some diagram, so which is our new designed actuator at the bottom of this diagram. So we have mentioned that we use a pneumatic source to control the actuation movement. So we can observe from the diagram that when we detect the bending motion, and then we try to inject pressures inside our actuator. So we can imagine the contraction force is trying to embed it at your lower back and trying to assist your muscular movement. And then we have done some of the tests in our lab. We recruit some of the students, we recruit some of the volunteers in our lab. In our lab, at the first step, we try to validate whether how we can reduce your lower back muscular effort when we are trying to use the suit. And then somehow we want to make it as a simple and easy, affordable product as everyone in the world can accept and afford it. So in the market, there is lots of exoskeleton devices, just like they are talking about thousands, 10,000, 100,000. So they're good, but we want to make it as massively deployed to the field as possible. So we want to break through this barrier. We want to make it as simple, as affordable as your iPhone, as your computer laptop. So everyone, actually, me and you can even buy one to put it in our home if we are interested. So we offer some of the options. So you may have, if you have visited our lab, so you have actually seen that we have a version that is embedded with a jacket, because we noticed some people that they don't want to get attracted. They don't want to get noticed by people that they are wearing something very new, and then they want to cover it up and don't want others to know that they are using the exosuit. So we offer some option that we embedded the devices with a jacket, so they can work without getting everyone's attentions. We are currently rolling out to the industry thanks to the help with OSHC. Specifically, want to thank Dr. Vincent Young and Mr. Elvis Cindy sitting at the back. And then they really helped me a lot in deploying to the field. And then we focus more on the in-house construction sites, because this is somehow a very new devices. Getting the very new devices onto a complex construction site at the first time, there may be some unforeseen problems. So actually, we kickstart our project in some fairly confined and fairly tidy construction sites, in an in-house construction site. And then we actually take some of the devices to some of the small logistic house in Fortan and try it. So this is somehow our current design, and then we are trying to look for future upgrades, and we want to, because we are actually trying to minimize the weight. So our exoskeletons, our suit, the weight is about 1 kilogram, but we are not quite happy for that. We want to make it as lightweight as our daily clothes, as less than 1 kilogram. And then this is our team. So myself as a PI of this project, and then we have some PhD student and some research assistant in doing this project. So thank you very much, and then hopefully if there is time, and then welcome all of you to visit my booth and then to test the devices, and yeah, let's see how we can work together. So thank you for the invitation from the exhibition and the hoster. So thank you.
Thanks, Kevin. So the next speaker is Mr. Harrison, who will share with us how he made use of the drone to do inspection for buildings.
Good morning, everyone. Pleasure and honor to be here to speak in the conference today. I'm Harrison, the CEO and founder of Respect. So as Respect is an AI company that developed the AI robotics technology for the safety of built infrastructure. So we believe that the 3S, which is safety, serviceability, and sustainability. So we developed the technology to enable the safety in a cost-effective manner. The first question that you may probably ask is why safe inspection is important. So you can actually encounter quite a lot of and experience quite a lot of different disaster, or may not, right? Or heard of it, like the earthquakes, like bridge collapse, building collapse, and some minor but very annoying cases like water seepage from our house, from our apartments, like the falling from heights, right? So many different cases and accidents happening all around us in our daily life. But why those issues can't be fixed? Why? It's because like all these cases is being manually inspected by human beings. Human is very professional. We are very intelligent, but you know, from time to time, like because of the cost issues, like inaccurate or difficult to measure, like all these combined becomes very difficult to address the problem of inspection and make it much safer for our environment. So in order to address this problem, we make a AI robotic solution to address all these accidents from happening, to make it like more predictive, more preventive, in a way that we invented the AI robotic solution to address all these problems, including the IoT sensors, like you can name it like the robotics drones, or even like the UAV that combines to improve the inspection efficiency by more than 87%. So you can know that like the overall flow becomes much more autonomous. Instead of asking our teams to inspect on-site, taking pictures, go to dangerous site to inspect, go underground, right, to take pictures and come back with the data analysis and write the report for you. So we don't need it now. So we deploy the drones, which is fully autonomous, outdoor and indoor. And we have accurate positioning for all these data that can be analyzed on our AI Inspector Car platform. So you don't need to actually go on site, but we can deploy multiple robotics for you to cater and address all these inspection problems for you. So, and we invented 6 different AIs. We quite well known about like the visual AI, which is like to identify in a visual way, like some defects, spallings, cracks, delamination, you name it. Thermal AI to identify the thermal anomalies, like if there is any debonding, like any water seepage issues that potentially happening, that we can detect it by thermal AI. LiDAR, we can accurate measure about like the dimensions of the anomalies that happens on there. For example, if there is a spalling, we don't need to climb over there. We can actually accurately locate and identify with the LiDAR technology. Like vibration AI, we help Disney to deploy our vibration technology on their roller coaster. And we help them to monitor all kinds of like bearing, moving parts, to make sure that all these parts are being monitored in a predictive manner. Magnetic AI, we deployed on multiple cranes in Hong Kong, like all these metal wire rope. So in a traditional way, people just like inspected based on bare eye inspection. They inspect on a peripheral surface of the wire rope. But as you know that like nowadays we carry much heavier objects and different architectural MIC in the construction site. So the integrity of wire is very important, that we need to monitor in a daily basis or even 24/7. So the magnetic AI helps us to monitor not just on the peripheral surface, but on the inner wire to see if there is any broken wires, any abrasions, any like integrity issues in the wire. And then the microwave AI is like the structural that we can help detect about like structural integrity of our buildings. That we don't need to just look at the peripheral surface, but we can look at by that technology to inspect about like the rebars, the concrete, are they in a proper format. So that is like some of the deployment that we have deployed in overseas, and also of course in Hong Kong, like the Vienna Airport. We recently have done the inspection for Vienna Airport, and also the tech center in the Silicon Valley. And this is the indoor drone that we helped different properties management company and the asset owner to help let them like deploy all these like indoor inspected drone without pilot, without human intervention. So you can like go underground and inspect like some dangerous zone and some remote and difficult access area that we can still have all these robotics AI to accomplish the difficult tasks for you. And last but not least, like all these data come back with the Inspectica platform, our AI platform, that give you a comprehensive analytics platform for you to have a view in one go. That is the microwave. So you can see, we can inspect inside the structural. You can see very clearly about the rebars, the integrity inside the concrete to give you a glance in a very clear idea. So that is all the inspection tech that we have built so far for the smart city, including the building inspection, bridges, the road inspection, etc. So we have inspected now over 500 buildings already, including the ICC, like Bank of China, and also Parliament House in Brisbane, etc. Yeah. So thank you very much. Because of the time limited, it's a great pleasure to share with you all and look for further collaboration. Thank you.
Thanks, Harris. If you have any further questions, the booth is just outside. Last but not least, may I invite Mr. Ray Choi, Senior Consultant from OSH Hong Kong, to share with us how we implement heat stress prevention solutions.
Thank you, Cindy. Good morning, ladies and gentlemen. It is my honor to be here to share with you our project. Due to the time limit, I will make it short. It is very hot in Osaka, right? Same in Hong Kong, our very hot day in Hong Kong increased by 50% in the past 10 years. So our Labor Department in Hong Kong has issued relevant guidance notes and established a system of heat stress at work warning in Hong Kong. Our employers in Hong Kong have to conduct risk assessment specifically for heat stress to protect their worker against the heat stroke problem. So our employers in Hong Kong, whenever the heat stress warning is issued, they have to implement a set of safety control measures against heat stress. As you may already know, there are many safety measures against heat stress. We will focus on two parts today, including the heat dissipation and the resting time for our employees. To do this, we want to evaluate which cooling products or methods are most effective for our employees. So we conduct a survey with the Hong Kong Polytechnic University to find out which is the best cooling product. Please allow me to show you the results here. We have two parts for our study. One of them is the cooling product for the employer to use while they are working. 3 seconds for you to guess which one is the best. We have the cooling collar here. We have the portable fans and cooling vests. The answer is cooling vests have the most effective effect for cooling down our worker. We have our product right over there in our booth, so please come to our booth to have a look. And the second part of our study is to evaluate the effectiveness of our cooling product to be used during rest break after working in hot environment. So we have a little bit more product here, including the solar fan, cooling towel, and the method of immersing our front arm into water of room temperature. Again, 3 seconds for you to guess which one is the most efficient way to cool down our worker after work. So the answer is arm immersion. It has a very effective way for our workers to cool down. Actually, this method is now being used by our firefighter in Hong Kong after fighting in fire scenes. So as a quick conclusion, this method not only protect our worker, but also enhance the overall productivity for our organization. So it is a very good method for both of our employers and employees, which is a win-win situation. And so thank you so much for your attention. If I may, I would like to remind that besides of cooling product, our safety control measure against heat stress is also very important. Just a few seconds for you to have a look for the safety tips here.
我天有我熱水櫃，熱到你哋瞓低晒。歡迎大哥。咩話？竟然用埋風扇散熱？哼！我再嚟，烈日當空。
中暑冇咁易，遮陰工作，補充足夠水分，去陰涼嘅地方唞唞。 對付熱鼠怪，幾招搞掂晒。
我會再嚟過㗎，你哋小心啲啊！
And thank you so much for your attention. Thank you.
Thank you. Thanks everyone for to participate in this panel, and also thanks all the speakers that have provided very insightful sharings this morning to us. Unfortunately, we are running out of time and we won't be able to answer any questions from the floor, but the speakers will, I guess, hang around in the Hong Kong Pavilion just outside the hall, and you can continue to ask them questions and to exchange some ideas. Thanks once again. Thanks all the speakers, and thank you everyone.
Thank you very much, Ms. Chow, and all speakers. Could you please give them a warm round of applause? ありがとうございました。